Bust it.
Same concept applies. Always work from distal to proximal. Okay? And again, we're going to evaluate the polymer surface of the foot to make sure that we don't have any injuries or foreign bodies that would cause your patient to be lame, okay, and the nail beds as well. And again, you're going to go through all of the joints, make sure that you put everything through flexion and extension. You're also feeling for any swelling or heat or crepitus as you're doing all of these range of motion exercises, okay? You want to make sure that the carpus can bend all the way without any pain, okay? Sometimes you can perform this and the patient will be painful, but they won't respond. And the way that you can tell if you're actually causing pain, one of them is that they will respond. They'll turn around, they'll look at you, they'll try to bite you. But the other thing is if you look at their pupils while you're doing something that you think may be painful, if the pupil expands or if the pupil dilates, then you know that you've just caused some pain. So you may get a stoic patient, but if you look at their pupil while you're performing these, you may find a painful area that they're trying to hide. Okay, so flexion and full extension. Okay, and again, you're going to feel, remember that the carpus is made up of a bunch of different bones with different joints inside there, so you want to make sure that you're palpating all through here to make sure that you are not missing any areas of swelling or pain. Okay, the carpus only has short medial and lateral collateral ligaments, so you can still put the same kind of pressure. And again, I'm not putting a ton of pressure, I'm just making sure that it's stable in a medial and lateral plane. Palpate again the bone. Okay, and again here, this is where the bone is, and I'm just palpating it to make sure that he's not responding painfully. Okay, and then you support the limb, okay, and bend, flex and extend the elbow, and you're again testing for smoothness of motion, crepitus, heat, pain. Okay, most of the time with OCD lesions, they'll be painful on the medial aspect. So if you, in flexion and extension, put a little bit of pressure medially and they suddenly respond, then you know that there may be an OCD lesion there medially. Okay. The other thing that you can test the integrity of the medial and lateral collateral ligaments of the elbow is to do the Campbell test. The way that it's described normally is that you have the patient in sternal recumbency and you actually place the limb over the edge of the table, and then you're able to actually measure and see how far the limb can actually turn. That's great if you want to actually have a measurement, but if you're just looking for general stability, you can just do the examination in lateral recumbency, 90-degree angle in the elbow, 90-degree elbow in the carpus, supporting both, and you're just going to supinate and pronate the carpus, okay? And if you can actually see up here that there's movement, okay? But the lateral and medial collateral ligaments prevent over rotation. Okay. Moving up, again, feeling for the humerus, and the shoulder joint is here, okay? To evaluate the stability of the of the shoulder, excuse me. So flexion and extension again. And then evaluating the muscle symmetry of the scapula itself. The spine of the scapula, you should be able to feel it, but it shouldn't be so prominent that you can really clearly visualize it.